you. Now we go to Grahame Morris.
Thank you, Madam Deputy Speaker. And I'd like to cover three areas in my contribution. I'd like to speak about inequality. I'd like to speak about COVID secure workplaces. And I also want to make some mention of cancer services that I raised with the Prime Minister a little earlier this afternoon. I was rather concerned following the Prime Minister's statement earlier that the government maybe hasn't learned its lessons from previous mistakes, that there is a direct and undeniable correlation between COVID-19 and inequality. The many heat maps that have been published showing COVID infections, hospitalizations and fatalities over the last year have illustrated the close correlation between COVID prevalence and areas of deprivation and high inequality. Indeed, a worrying trend has emerged in recent days of a high COVID infection rate in some of the communities that I represent in the Easington constituency, because while infection rates across County Durham continue to fall, there are higher infection rates in Peterlee East and Hordern compared to other areas. One reason: the poorest in many cases have no option but to continue to work, even in conditions that are not COVID secure. Those in insecure employment or on 0 hours contracts, agency workers, for example, they do not have the finances or security that they need to self-isolate. The poorest are facing greater poverty if the government do not listen to the likes of my own union, my own trade union Unite, who are calling for the government to retain the £20 uplift in universal credit and for the uplift to be extended to the legacy benefits, a call supported by many organisations, including the cancer charity Macmillan. Remarkably, Madam Deputy Speaker, there are many instances of workplaces that staff believe are still not COVID secure. PCS union members at the DVLA headquarters in Swansea are balloting for strike action today after senior managers and ministers, some of whom appeared before the Transport Select Committee that I serve on, have consistently refused to listen to their concerns. This is despite the fact that there have been over 550 COVID cases in recent months, and we've seen the tragic death from COVID of one staff member. I also want to mention briefly the need to change our approach to cancer services and the need for a dedicated cancer budget. The cancer backlog after the first wave could be 50,000 patients. We could emerge from the pandemic with 100,000 in the backlog. We all want a safe and orderly return to normal, but one of the biggest obstacles through this pandemic has been the government's inability to follow the science and have turned a deaf ear to criticism.